Hi everybody, it's Beth Rostron, Sarah Mack. We wanted to record some information for you to give you an update on the current situation of the outbreak status and things that are going to be coming up in the near future for staff. So the takeaway points from outbreak status. If we suspected that you had contact with one of the 2 positive cases, you would have already been identified. We sent information to the state of New Hampshire on Saturday the 19th. So immediately when we found out 2 results, we were in the building working on that, and that information was shared with the state of New Hampshire officially by 9 p.m. Saturday. So we believe that it's a very tight circle of people who had prolonged exposure. We have extended our outer circle of folks who we've included in the testing with the state of New Hampshire simply as a precautionary measure. So people who share office space frequently, people who routinely have contact with these people. We don't believe at all that any health services staff have been affected at this point, or any assisted living residents. In addition to that round of testing with the state of New Hampshire, Kendall is going to start surveillance testing for staff next week on Tuesday. What that means is that we will be taking a percentage of staff members from every department, a percentage of residents from assisted living and independent living, so that we can move forward with our own baseline of testing. If you are identified as a person who should be testing, we're focusing on frontline staff, people who have high risk themselves that we know of, and some other factors that as a senior management team and health services team we have identified of people who should be included in this round of testing. So if you are included in this testing on Tuesday, you will be directly notified. In the future, in say several weeks, this may look like a different picture, and as soon as I know what's going on, we will share more information. So if you have specific questions about your contact to a positive case, you can call or email me. Just know that it's going to take me a little while to get back to you. If you had been exposed, you would already know by now. So we feel like we're really safe where we are at this moment in time. We just need to put some things in place for going forward.
And so Beth, just a quick question. If somebody is notified that they have been in contact with somebody who has tested positive for COVID, what should their first steps be?
The state of New Hampshire will give you specific guidelines, or the state of Vermont, depending on where you live. There are 2 trains of thought. In long-term care, nursing staff, people who provide essential roles to take care of residents, you can still work under certain conditions. Those are called essential employees. So pretty much all of us in this building, you'll probably be allowed to still work if you had some type of exposure to a positive case. We're all wearing face masks, we're all wearing eye protection. We did extensive cleaning and disinfection of those work areas that we thought were highest at risk. So it would be a specific conversation with you about your role. Your families, if you had an exposure, your immediate family are not required to quarantine unless, of course, there are other specific situations going on. Somebody's really immunocompromised. You would have a personal conversation about your specific lifestyle and things to do.
Okay, thanks. And Sarah, we've had questions from staff about flu vaccines. So could you talk a little bit more?
So the flu vaccine is something that's provided for the Kendall staff at no cost to them. We have flu clinics coming up. Those are posted by the schedule, and I believe they've been passed around to the units, the dates and times those flu clinics are happening. The vaccine is not only another layer of protection, but it also provides support if you were to contract the flu by lessening your symptoms. I know that we're all wearing masks and everyone has concerns that they don't need the flu vaccine if they're wearing a mask. However, the mask and the flu vaccine are both tools that help limit our exposure to our residents of carrying a virus to them and help us stay safe as a health services team. I encourage that if you do not have any negative reactions to the flu vaccine, that you strongly consider it as a way to take care of your resident population and provide prevention in our community.
It reinforces some of the things that we're doing because of the pandemic, but in addition to the fact that we work in healthcare, we choose to
Correct.
work in healthcare. So
do.
we should also choose to live our healthiest life to care for our residents. It all boils down to the fact that we need to do everything we can to keep them safe.
Okay, and Sarah, another question that's come up about COVID pay. Would you like to address that?
So COVID pay is based on if we have a resident infected with COVID. The guidelines are clear, and I do have a flyer hung by the schedule which addresses this that was just recently put out. So if you have further questions about COVID pay or how that works, as I said, there are details posted by the schedule in the nursing area which review that if residents become infected, then there are changes to rate of pay.
Okay. Ladies, anything else?
I just want to thank everyone. I know that, a lot of this is happening very fast. With the current situation, we have to be responsive and we have to be fast about that. I apologize if anyone doesn't feel that they had correct communication, and I encourage them to seek out their supervisors, myself, to assist with communication or any communication barriers.
We're trying to share the best information that we can, and sometimes that can't be done on the same day as we're finding out
Right.
about it. We really need to coordinate with other departments, the state of New Hampshire. So, thank you for your patience.
Yes.
I know that it's all confusing and we're getting mixed messages. Believe me, I know we're
It's
getting mixed
changing daily.
messages. So it's best that we filter it some to you
Yes.
so that it makes sense and that it's actually applicable to what we're doing here.
And I just want to thank everyone. I know that we've been through some challenging times, and we've heard a lot of positive comments about the health team and the services, from our independent living residents to our assisted living families and residents. So I just want to reiterate that I know it's not been easy, but I am so thankful for all of you and your dedication and help that you provided to the team. And I look forward to us getting through this together.
Absolutely.
All right.
Thanks.
Thank you.